May is recognized as Anti-Tobacco Campaign Month, and this period provides an opportunity for individuals as well as organizations to raise awareness about the dangers of smoking and promote healthy habits. This year, World No Tobacco Day 2024 under the World Health Organization will give a platform to young people across the world who are urging governments to shield them from predatory tobacco marketing tactics. Children are said to be using e-cigarettes at rates higher than adults in all regions, and globally, an estimated 37 million youth aged between 13 and 15 years actually use tobacco. Well, for this discussion, we've roped in Professor Lekan Ayo-Yusuf, who is the director at the Africa Center for Tobacco Industry Monitoring as well as Policy Research. Professor, a very good afternoon to you. Thank you so much for joining us. Look, we are currently on the Anti-Tobacco Awareness Month. Talk to us about some of the programs as well as initiatives that are currently in place with organizations such as yourselves, and maybe collaborative efforts with government to increase awareness as well as assess those trying to quit or are suffering from tobacco-related health hazards.
Thank you. Good afternoon to you listeners and your viewers. So the month, as you said, is dedicated to protecting young people from the tobacco industry, because it is very clear that without young people, the industry itself would not profiteer or would not have any further business. So their focus is actually recruiting more young people, because they're all the customers, they know they will die of the tobacco diseases. So if we can protect the young people, and it's fundamental child's right in South Africa, there's no right that is fundamental for smoking or for smokers. So in terms of what is lined up is, as you said, it's a month to increase awareness of the dangers of tobacco, and particularly among youth, to understand that when you see social media adverts and influencers, they're usually paid by the tobacco industry. It's not because they like you. So they have flavors that are put into poison to make it easier and attractive and appeal to young people. So we are going to be raising this awareness in schools, at the universities in particular, where we found e-cigarette use to be very, very high.
Look, Doctor, I mean, while we talk about that, speaking of attractive as well as appeal, I mean, we know that you heard in my intro that the youth that are using those e-cigarettes or vaping or habli for social as well as recreational purposes, or even peer pressure, are said to be on the rise, with staggeringly frightening figures of about 37 million globally. This is quite hectic. I mean, habli has recently been blamed for the recent mysterious deaths as well as lung-related diseases. So how are you encouraging the youth to stay away from the usage of such tobacco products?
So indeed, habli has become a global crisis, and particularly also in South Africa. In fact, our estimation is that if we did not have habli, we would have had a much more stable prevalence of smoking, tobacco smoking in South Africa. But with habli and with e-cigarettes and manufactured cigarettes, we now have a much larger population of those who are addicted to nicotine. So indeed, what we need to do is to create an environment that makes it more difficult to get access, for young people to get access to habli, and to be able to use habli in these public spaces where they usually use them. And this is the reason why we are supporting the current tobacco control and electronic control bill that is put before the parliament. And we're urging government to actually speed up the adoption of this bill, because that would restrict the use of habli in public places. It will restrict the marketing of all this as flavors and the display at the point of sales that makes this attractive to young people.
But how effective will this be, Prof? I mean, we've seen with, of course, the ban of alcohol-related marketing as well as advertising, it hasn't really made much of a significant difference, just to put it in a better context, in terms of the consumption of alcohol and the way that people were actually using alcohol. So how is the ban or potential ban on cigarette or tobacco-related products going to assist in fighting the scourge?
Well, I must say the alcohol advertisement and promotion has not been banned, as you probably see on TV every time before any sport event or any popular event on TV, which is currently. But the advertisement of tobacco products are banned on TV. And I must say, between 1995, when these bans came into place, and up to about 2010, we had a very significant decrease from 33% of South Africans smoking went down to 22%, actually as low as 20%. And it has stayed, manufactured cigarette has stayed about that level. Now, what we have is the oblis, which is now added about 5% onto that to make it 27% in tobacco smoking in total. So it is not, and many countries that are putting this type of restrictions and laws have actually seen significant drop. For example, in Uganda, they've had a significant drop from the same levels we had in 20%. They're now low to 8.4%. So it's about making sure that we put in the laws and everybody changes the culture of talking to each other, not necessarily having to police, but saying to the next person, please don't do the hobby next to me, because now you know the law is given to you. So it's a changing the social norm. It takes time, but there's evidence that have shown that this works, both in South Africa and other parts of Africa that have introduced this law.
Prof, unfortunately, I'm out of time. I mean, I wanted to expand this debate further to the illicit trade and how it also contributes to the young people actually getting very easy access to those tobacco products, because they automatically become very cheaper in the market. But we're going to leave it there. Thank you so much for your input, Professor Lekan Ayo-Yusuf there.